Hello, myself Dr. Manajeet Patil, consultant plastic and cosmetic surgeon working at Aster RV Hospital, JP Nagar. So today I'll be discussing about abdominoplasty and frequently asked question about the abdominoplasty. So most of the patients ask what exactly is the abdominoplasty. It is, in a simple terms, we call it as a tummy tuck, wherein the excessive fat and the skin fold is trimmed so that you will have a flat abdomen. So who are the right candidates for this surgery? Someone who has got a lax skin or excessive fat on the anterior part of your abdomen. In those cases, this surgery is quite suitable. So someone who has lost a massive weight also, or someone who has undergone a bariatric surgery also, they will have a quite a lax skin. In those cases, the abdominoplasty is very suitable. So the next commonly asked question is, are there any types of abdominoplasty? Yes, there are two types. One is, we call it as a proper abdominoplasty or the full abdominoplasty, and the other one is a mini abdominoplasty. So it is done based on the problem patient has. For example, few patients will have excessive skin or fat just below your belly button only. In those cases, we do a mini abdominoplasty. And someone who has got excessive fat and skin fold all along the abdomen, in those cases we do a full abdominoplasty, wherein skin, fat tissue is excised, and we do a tightening of the muscles also. Will there be a scar? Yes, answer is yes, but the thing is, the scar will be well hidden. Scar will be placed in such a place so that it becomes completely hidden in your inner garment. So what to expect when you consult your plastic surgeon? So when you meet your plastic surgeon, patients will be evaluated completely, check for the laxity of the abdomen tissue, check the tone of your muscle, rule out any of the hernia if patient has, check if the patient has undergone any previous surgery which is likely to interfere with the outcome of the abdominoplasty, and explain the patient about the possible types. If necessary, if patient needs an additional liposuction, all this can be discussed, including risk, complication, outcome, pre and post surgery photographs, so that patient gets a full picture of the procedure. So it depends. So first is important is the anesthesia, then comes the incision. Incision in the sense a cut. So cut can be we place the cut just above the hair bearing area, and it will extend like a cycle handlebar on either side towards your hip bones. So if you have a lot of skin or excess skin, the skin incision may extend little on either side. You will have a larger skin. So once we cut open, we'll pull the abdomen wall down, and we'll take out all the excess skin fold, and the next incision will be around your belly button, so that the belly button is freed, so everything is pulled down, and tuck it. That is the reason why it is called tummy tuck. And meantime, if the patient has a divarication of recti, that means if the rectus muscles are separated, especially it is seen in the woman after the childbirth, especially after multiple pregnancy, the rectus muscles are separated. In those cases, we bring the separated muscles together so that they'll have a nice, neat, flat abdomen, and the skin is tucked down and the stitches are put. We may put certain tubes to drain out all the collections, and there will be some bandages, and that is how the surgery is done. So next comes the recovery. So how about the recovery? You may have to stay in the hospital for about 24 to 48 hours, and a few prophylaxis are always taken. If patient is very obese, say, we take precautions for deep vein thrombosis, and we'll make the patient ambulate in the sense make him walk around maybe in the same evening or maybe the next morning, so that patient recovers well. And you may have to come for follow-up maybe for 1 or 2 times. There will be a bandage. You may have to wear some abdominal belt to maintain the operated site in a proper position, and recovery will be pretty good, and in a matter of 7 days to 10 days you will recover completely. Yes, there will be a risk of anesthesia, there will be a risk of scar, there will be seroma, there can be hematoma or infection, delayed wound healing if in case if you are a diabetic, which is so these are the things, common complication or risk which we can expect in this patients. So most of patients who come for abdominoplasty will also discuss about something called as body lift. So what exactly is body lift? There are certain patients who have a abdomen which is quite lax with the excessive fat and all, and there are other group who have lost massive weights following diet, exercise, and also following the bariatric surgery. In those cases, the patient will have a lax skin along their arms, along the chest, along the belly, around the thigh. In those cases, we do a other procedure called as a body lift. Body lift is done to address the saggy, lax skin of entire body, be it your arms or thighs or abdomen, or even on the back side, which we call as a circumference or belt lipectomy. So that is the complete body lifting. It is body contouring.